Hi there, I'm Dr. Deborah Herchelroath, but most people call me Dr. H. Welcome back to my video blog. Today's topic is Pap Smear Guidelines. Pap smear recommendations can be confusing for patients. I can't tell you how often a patient of mine asks me when her daughter should get her first Pap smear. And that's because things have changed so much through the years. Recommendations in medicine are ever-changing, especially as our technology improves. Why? Well, our ability to detect disease improves, plus our knowledge of the disease state improves too. Pap smears are actually a huge topic that I won't be able to fully cover in one blog, but I'll get started here today. What's a pap smear? A pap smear is a gathering of cells from the cervix. The purpose of a pap smear is to detect cervical cancer. In fact, we use pap smears to detect pre-cancer of the cervix long before cervical cancer ever develops. That's how pap smears save lives in this country. Many women equate a gynecologic exam with a pap smear. It's just not always accurate. Most cervical cancers are caused by the HPV virus. I know, can you believe that a virus can cause cancer? But in fact, viruses can cause many cancers, including penile cancer, laryngeal or throat cancer, oral cancer, including tongue and tonsillar, anal, vulvar, and vaginal cancer. HPV is thought to be transmitted sexually, although there have been reports of lower genital tract HPV infection in women who've never been sexually active. HPV is common. In fact, approximately 80% of women will be HPV positive at some point in their lives. And usually, thank goodness, HPV is transient. What's that mean? Well, it means that although many women have HPV at some point, most will clear it or it will become undetectable to the technology that we have today. There are many subtypes of the HPV virus. The two most dangerous, the ones that are most likely to cause cervical cancer, are types 16 and 18. We now have the technology to test for these specific subtypes. Pap smears are categorized to let the gynecologist know if further testing needs to be performed. Remember, a pap smear is a screening test. It's not a diagnostic test. We can tell by the result if we need to perform a more specific test, like HPV testing or colposcopy. In my next blog, I'll explain colposcopy and discuss the actual guidelines. Until then, thanks for watching. I'm Dr. H.